And we want to turn now to a recently published article in the American Journal of Cardiology. It shows research that supports an alarming drop in emergent cardiac events during COVID-19. To talk more about the article and its research, we have Dr. Amanda Zaleski. She's a clinical researcher and CPR instructor with Hartford Hospital's Department of Preventative Cardiology. Hi, Doctor. Thank you so much for joining us this afternoon.
Thanks for having me.
I want to start with a simple question to explain what the article is talking about. What exactly are these cardiac events?
Sure, great question. So what we did is we examined cardiac catheterization laboratory activations, and that is just a really fancy way of saying who qualified for getting a cardiac cath or looking inside their blood vessel. These are emergent events. And what we did is we compared those to previous months to see if there were any changes related to COVID. And in fact, we saw a 38% reduction in patients presenting to Hartford Hospital with acute heart emergencies.
Well, and like you just mentioned, a significant drop in the number of cardiac events in March and April. So it times up with COVID-19. Do you attribute that to the fear of that exposure?
Yeah, it's interesting. We don't really know quite yet. We don't have a hard look at the data. We know, of course, that a certain proportion of those patients likely suffered from COVID, unfortunately. Those patients aside, we have reason to believe there's actually a large proportion of missing patients who are at home or who are fearing coming in either from COVID itself, from contracting it, or they feel that they might be burdening the healthcare system. And so for those patients, we really are encouraging, if you have signs or symptoms related to a heart event, to please come in, and we're here for you.
And kind of going off of what you are talking about, we definitely want to encourage people to come in and get the help that they need. But we also worry with the state beginning to reopen. Are you worried about seeing a change in numbers?
So that's an interesting question. So for the month of May, we already starting to see patients that are coming in. They're reporting delay. They unfortunately are looking much worse in terms of like more longer term serious complications. We think and we know in talking to patients that the fear is from the disease itself. So as things open up, that's not going to change, right? It's not the stay-at-home orders, it's the disease itself. And so really until COVID goes away, right, or we have a much better handle on it through vaccinations and herd immunity, et cetera, I think we're going to be seeing this fear for a long time.
And Dr. Zaleski, aside from being a clinical researcher, you're also a CPR instructor. So with it being the CPR Awareness Week, what are some modifications someone could make when giving CPR during this coronavirus outbreak?
Yep, that's a great question, and thank you for bringing awareness to CPR Awareness Week. So we know that outside of COVID, actually 70% of heart events occur in the home, and so that's much likely to be higher now because everybody's home. And so any of the precautions that you might take, worried about risk related to COVID and CPR, you're already living with that person. Now, outside of that, the American Heart Association recommends that if you were to come upon someone who's unconscious, breathless, and has no pulse, and you're considering giving CPR to, of course, weigh your own personal risk, we are recommending hands-only CPR, so no mouth-to-mouth. That can be just as effective as breaths. You would wear a mask, and the patient would have a mask or have their mouth covered. There is a small risk of generating aerosols with COVID through chest compressions that you should be aware of when appraising your own personal risk. But in general, the American Heart Association recommends assuming that you're low risk and comfortable doing it and safe, to saving a life from a heart event, the benefit likely exceeds the risk of contracting COVID from giving CPR.
Okay, a lot of good information there, Dr. Amanda Zaleski. Thank you so much for joining us this afternoon.